Hello, good morning and a warm welcome to News Desk on your Joy News channel. I'm Benis Abubaid. With 3 days to Christmas and the euphoria in town is getting very intense. Well, as you prepare to go about your plans for the holiday, remember to not lose sight of what you intend to drink and eat. As much as you want to be adventurous with your diet, there's, however, a great need to ensure you're not abusing whatever is available to you. Now, some can be very addictive, yes, particularly the drinks. This is according to a health expert. Now, for more tips on this, my colleague Daniel Dazi has been engaging the head of the addictive drugs unit at Kolebu, Mr. Amegashi, on the subject. Enjoy the chat.
Still watching News Desk on the Joy News channel. I am Daniel Dazi. Now, the holiday season brings with it an opportunity to enjoy, to meet with friends, to commiserate, and ultimately for friends to have some fun. However, it is also an opportunity to use substances like recreational drugs, which could cause permanent damage or harm to any individual. So today we've come to the Kolebu Teaching Hospital, where Mr. Logosu Amegashi, the head of the Addictive Diseases Unit, he's someone who has worked a bit with people who, in the name of having a little fun, ended up with serious permanent damage to their brains and their bodies. We want to find out from him the danger associated with using narcotic and recreational drugs around this time of the year and how we can protect ourselves. Thank you very much for joining us, sir.
Thank you. I'm privileged to have you here.
Right. So in the first place, is this conversation justified? Do we have an increased amount of use that is a cause for worry around this time of the year?
Well, it's this time is not necessarily the time for increase in the number of people who are going to use. It will interest you to know that around this time, people are taking decisions to quit using. So this sometimes happens to be our peak season where we receive clients who are preparing to quit using. But it doesn't mean that new people who are not aware of the damages that drugs can cause are not also going to enter. They enter. This is a time. Some not necessarily because they want to get addicted, but out of conviviality, out of sense of belonging, celebration, they go try drugs that are psychoactive. And when we say psychoactive drugs, we are talking of mind-altering and mood-changing substances. Some people use it.
Examples being?
Alcohol, marijuana, cocaine, heroin, tramadol, Valium. Any of those drugs that can change your mood and your mind, we call them psychoactive drugs. And they end up to be addictive. They are equally addictive too. So around this time, festive times, a majority of people, we have new people trying for the first time the drugs. Those of them who are fortunate enough will have very bad reactions when they take it the first time, adverse reactions. So it makes them very unlikely to go back using it. But those who claim they are fortunate now will enjoy it. They have a sense of euphoria, a sense of high, well-being. So they are tempted to continue using after this festive period. And that will be the journey to distraction. You understand?
Right. So despite the fact that from your study, your observation, there are more people likely to make a decision to quit using these drugs, whether or not they quit is a different question. There are more people who are more likely to experiment, not for the sake of addiction, but for the sake of trying something new and enjoying the festivities a bit longer. Do we have any figures to back this?
Well, the figures may not be representative of the whole nation. Every institution that is doing something about drug addiction has their statistics. I have the addictive diseases unit. We have. That is why I was even able to tell you that we have a peak season. Most of the times when it's getting to the end of the year, and somewhere late January, you see the number of people who are coming for treatment to increase. That's about the peak. The first 3 months of the year, you have people wanting to have something to do about their drug situation, substance use disorders. Now, but there is no statistical record as to the number of people who will be trying for the first time. It is not available. It could be at the level of the families. They will know that this is my first time, this is the first time my son is tasting this thing. And then some peers will know that this guy is now a newcomer trying it. But for them, there is no statistics. Now, those who are quitting in the various institutions too, we do not have a national statistics now. The Narcotics Control Board has started something, but it will interest you to know that those out there in the ghettos and the street who are not in treatment centers because of the financial inability to be able to access those facilities, because some of them are addicted so much for fear of withdrawal, they will not want to do anything about recovery. Those numbers there are greater than what we are seeing in the clinics. Therefore, it is difficult to put a figure down that these are the number of people who are now entering and those who are making the effort to quit.
So based on that, why then is there an increased danger of people entering? On what basis are we saying that there's an increased danger of people trying drugs for the first time around this time of the year?
It happens when after the season, after ESMA, those of them who will start having problems with it would come. They are represented. They will tell you that they are first users. And that's their first time of coming to treatment.
And you have an increased number of that immediately after this holiday season?
Yes, it happens. Some of them, unfortunately, come with complications, like psychotic complications. For example, if they use cannabis, you understand? And then some of them come with other social complications. Some people smoke, then go get aggressive, assault parents, girlfriends, and the rest. And it's only then that sometimes they are arrested to the police station, then they give the excuse that I was drunk or I was under the influence of something, and then that will be the first time they are using it. So you will not necessarily have the data from the rehabilitation centers. It could be in the police station, it could be elsewhere.
So tell us a bit more about the effects of some of these mind-altering drugs as you define for us, because a lot of people, as you say, try these for the first time without thinking that it could have such an adverse effect on them.
Well, it is a progressive illness, and it depends upon the type of drug that you are using. Those who are using alcohol and then they enjoy it for the first time, for them to get hooked onto it, it takes an average of about 10 years for them to get hooked on it. They move from the stage of experimentation to recreation to abuse before they come to the stage of addiction. That is dependency, where it becomes a disease now, because at that level, you may be aware of the complications. It is affecting your work, it is affecting your academics work, it is affecting your marriage, it is affecting your socialization. You are now aware and you want to quit, but you cannot because you have become dependent. When you started using it, when you get to the stage of abuse, there's something we call psychological dependency. You have some sort of enjoyment that is more important to you than any other thing. To the extent that if you are a father or you are a mother and then you have money to use for your kids' school fees, the drug addict will prefer to use it to get drugs because he's hooked onto the drug. The other social responsibilities becomes opportunity cost to the drug use. So he or she will prefer to go buy drugs or take alcohol and then forgo those traditional responsibilities. Now, if for any reason the person is unable to do something about the usage from the stage of experimentation, recreation, and abuse, where the physical involvement of the body is not there, and it continues, because there's only a
What do you mean by the physical involvement of the body is not there?
When you get to the stage of dependency, there's physiological dependency, where when you don't use the drug, you suffer withdrawal period.
Okay.
That's what I'm talking about. But from the stage of experimentation, recreation, and abuse, it's only psychological dependency. When you stop using, you don't suffer physical pains.
Okay.
So it is easier for you, the user at that time, to quit on his own without any external intervention. So if for any reason you are unable to listen to your own self or listen to the complaints of other significant others and you continue using and you cross from abuse to addiction, then the trouble comes. It becomes two troubles, one God. Your mind will be hooked and your body will be hooked. That is why the scientists call it a psychosomatic condition. Your brain is hooked and your body is hooked. Now if your brain is sober and he says that no, I must stop this thing. When you attempt to stop, then you start suffering the withdrawals. And the withdrawals differ from drug to drug. The alcoholics will be having shakes, palpitation, running, sometimes diarrhea, sweating, uncomfortability until they take the alcohol. And when they take it, all these things. So alcohol becomes a medicine to cure the withdrawal syndrome. So
give me a moment. That takes 10 years. The average user?
An average, because some people can use to 15 years, 20 years, they will not be hooked.
So the average user out there would say there's not much of a danger, is there?
Listen, I'm taking it from drug to drug. Anybody who is using cocaine and heroin should not think that the alcoholic takes 1 year, 2 years, 3 years, because within a matter of 1 week, you can get hooked onto these narcotic drugs. So that is why it is very dangerous. That's why I've taken the time to explain it. Some people can get hooked onto heroin and cocaine, especially cocaine, in a matter of 3-4 days.
That it moves to the psychosomatic stage.
It moves to the stage of dependency from experimentation within this short period. And the withdrawal that you suffer from heroin and cocaine, especially heroin, is so devastating that you have abdominal cramps, diarrhea, joint pains, feeling cold, a whole lot of, they call it techie, that's the withdrawal syndrome. And it's very painful. The only medicine available is the drug, going back to the drug. So in Ireland, they said that when you die, if you are drowned in a river, they still use the same river to bath you before you are buried. That is the case of drugs. The drugs have created a problem for you, but you need the same drug to cure yourself. That is why in the ghetto, they said, I'm going to cure. The cure is to treat the sickness of withdrawal. You understand? So for the hard drug users, it doesn't take any length of time. The longest that you could go is about 2 weeks. You definitely get hooked onto it, especially where there's the availability of the funds. And if within that short time, the very righteous person who does not steal can become a thief.
Right, because now your body depends on it.
Yes, and it is like a survival. You must survive. You must survive. You definitely would use it. And our fear, especially in this season, is that whereas initially, in recent times, the trend of drug use is changing. At first, we have gateway drugs that we have cigarette. Then you move to marijuana. Then you move to cocaine, and you move to heroin. But these days, some people are starting smoking marijuana straight away without taking alcohol. I have cases who have started from cocaine without smoking cigarette and marijuana. The trend has changed.
How prevalent are these trends?
Well, they are not as prevalent as the ones going to the gateway.
But it's still a cause for concern.
It is still a serious cause for concern because they do not have even the opportunity to think twice about what they are doing, because within a matter of a week, you are hooked. And your sense of judgment and everything is taken away immediately. You understand? And for the various drugs that we have indicated, I must indicate here, I must show you here that alcohol is the most dangerous drug. Physically. When I say most dangerous, medically, because it causes so many medical conditions. But we sort of want to say that it is a precursor to most medical conditions. You know, alcohol is responsible from the head to toe seizures. We have alcoholic seizures that we call epilepsy. That was, without alcohol, it wouldn't have been there. Alcohol is noted for causing cancers of the throat, of the lung. It is noted to be the cause of most liver conditions, hepatic conditions, from fatty liver to cirrhotic liver and the ascites. Alcohol is noted, it goes to affect the reproductive system in several ways. You have been hearing of the fetal alcohol syndrome, where pregnant women exposing themselves to alcohol develop the children in utero have those deformities at birth. It is also responsible for oligospermia, that is reduction in sperm count, low sperm count, to the extent that it affects the fertility of some women. Sterility is also sometimes implicated. Alcohol is implicated in the causation of this thing. In fact, it will interest you to know that socially, alcohol has been found through retrogressive studies as some of the predisposing factors to HIV/AIDS and those other things. Alcohol is noted, even though it's not the cause of tuberculosis, it's noted to be a precursor to tuberculosis, because when you use the same glass with a TB patient, you go to a drinking, but you are able to get it through droplet infection.
So indirectly?
Indirectly, and in addition, it lowers the immunity of the body. Therefore, things, pathogens that will initially not cause disease in you would cause it. The same thing applies to cigarette smoking, especially when you pass you smoke a tip and give it to another person. If the person has any of the conditions, it's possible to contract it. Yes.
Is it true with cigarettes also about weakening your immune system?
Yes, cigarette. In fact, almost all the narcotic drugs, almost all the psychoactive drugs, they have that capacity. Yes. Even though we have our individual constitutions that make people to believe that, well, this guy has been smoking marijuana for 20 years, but he's not gone bonkers. He's still normal. But somebody will smoke for two days and then suffer it.
I wish we could talk a bit more about cigarettes and marijuana, because these are drugs that we find most commonly around, aren't they?
Fortunately, when Professor Kosa did that campaign against public smoking, you realize, you agree with me that cigarette smoking has gone down.
Yeah.
Yes,
considerably.
It's very interesting, and that is what we need to be doing for the other ones, because when they started talking about legalization of marijuana, the incidence of marijuana use is now up. It is already decriminalized, unofficially decriminalized. You see people smoking marijuana in front of everywhere, in the presence of the police, and nobody bothers. You understand? And I'm just from a rehab center. The statistics that we had last year and this year have shown something very interesting, because over the years, from 1993 that I started this thing, alcohol is the one that takes the lead in all rehabilitation centers. People that we see with alcohol are the highest. But last year and this year, it is marijuana. Last year and this year, it is marijuana.
And you believe this spawned
as to whether it is as a result of this campaign, nobody is yet to know.
Which is what I was going to ask.
Yes.
If
nobody is going to know, but why would it happen around this time? It has not been so over the years.
Are there any other factors that could be responsible for this?
When these things started happening, if you are in the hamlets of Accra, and when the debate started, you see people jubilating and burning marijuana openly and smoking. You go to the villages, and then somebody who is a weed smoker is passed on, is dead. Weed is smoked openly now, and they celebrate and they perform their rituals in the full glare of the police and everybody. You will one day see it. So yes, if that is not the sole contribution to these changes in the statistics that we are having, it could be a contributing factor.
But of course, there are other factors.
There could be other factors, yes.
That could. Okay. So we are talking a bit about the effects of these mind-altering drugs or medicines on your body, your mind, eventually. And we were very detailed about alcohol.
Now, when you come to marijuana, some of these things, when you go to our psychiatric institutions, most of the psychiatric institutions, and data that you can collect from families that are afflicted with the disease of addiction to cannabis, they will tell you, in the psychiatric institutions some time back, about 70% of the youth that are inmates there have cannabis-induced psychosis. If you talk to any of these things, whether they have a familiar this thing or not, there is cannabis-induced this thing. So that is one. Then aggression. In the area of aggression, where people, wife battery, husband battering, assault on children and the rest, it is all laid down in front of people who use cannabis, and not necessarily cannabis, sometimes cannabis and other distinct. Tuberculosis. When you do a retrogressive studies of the lung conditions, especially when you go to, there was studies that I did at the TV work some time ago, retrogressively, a majority of the people that were either smokers of marijuana or nicotine or both or with alcohol. So TB, tuberculosis or chest diseases are implicated in smoking of cannabis too. Now apart from that, there are researches that are not yet replicable in this part of the country. It is known for a fact that when you smoke marijuana, it affects your something we call the spermatogenesis. It affects your sperm formation, the beginning of the sperm. And it leads to denatured sperm that leads to congenital abnormalities, drugs, like the cleft palate and those things that you see on the TV. And then people are doing plastic surgery to correct. Marijuana is implicated. Marijuana is also implicated in the oligospermia that I tell you. Yes.
Low sperm count.
Low sperm count. It is implicated in most of the chest diseases. It is implicated in some other things apart from the mental derailment. It's also known to be involved in depression. It's a cause of depression, even though some people believe that it is also used to treat depression. You understand?
Okay.
So it has so many. It also has cardiovascular complications. The lumens of the blood vessels and the rest become, the size is reduced. There's something we call atherosclerosis and atherosclerosis. That makes it difficult for heart to be pumped. So there are complications of cannabis use, and then it can be found in hypertension and the rest, just like you can find it in alcohol use.
But you see, Ms. Amegashi, so far we've been talking a lot about related medical implications of using something like marijuana. I remember on News Desk recently, I interviewed Kex Dan Pongo, who speaks for the Rastafari Council, who make a very strong argument for the fact that most of these research have not directly linked marijuana to any specific mental or physical condition. It's most of the time it could be related, but not specifically, of course.
Now let's get this thing very right. Let us not start to debate whether it's the egg that came first or it's the chicken that came first. This is simple. Get this argument very simple. You are my son. We have familiar history of psychotic derailment in the family. For the past 21 years that you have been with me and you were not smoking, you were still stable and pursuing your profession. Then unfortunately somebody told you that cannabis could increase your intellectual capacity. You smoke and you became bonkers. You went mad. If you were a father, what are you going to say? There is no need for any scientific listing, because in the absence of that cannabis, there was not going to be a derailment of a very beloved son.
But you see, it would be simple.
We don't want to encourage the youth there to tell them that, yes, let's agree to disagree that cannabis is not really a causative agent to mental derailment. We must be very responsible in churning out some information to the public, especially to our youth. If this argument goes on that those who smoke the weed and they get mad, there's a mental ailment in their family, don't forget that there are some people who do not have history of mental derailment in their families, but they go mad when they smoke cannabis.
What about the many documented benefits of cannabis?
We are not bothered seriously about that. We are not. Because there are a lot of benefits from alcohol that people see. But it is not going to be good for any alcoholic to say that there's a benefit of red wine for my cardiovascular condition, then I'll start drinking red wine and get addicted and then precipitate my already cardiovascular conditions if there is. Listen very carefully. Let's say, for example, I'm an alcoholic. Then I have a heart condition and I'm on medication. Somebody introduces me to red wine and as a therapy for my heart conditions. But when I take the red wine, it makes me good to go back to hypertension. And then it affects all my social responsibility and I eventually die. So in the bid of trying to treat yourself with red wine, we must be very careful as to those people who are going to buy into this thing. It will interest you to know that there are some alcoholics who have been sober for 20 years and being responsible. They went to church and took the communion wine, alcoholic communion wine, and they relapsed and they were unable to do this thing.
So your argument is that by pushing a message of beneficiary use of marijuana, you're endangering people who under normal circumstances may not have abused it?
Who may not have abused it, whose their mental conditions were still being in the lantern form. It wouldn't have been uncovered. Are you getting the argument? Let's get this thing. I want people to get this understanding clear. I am from a family of mental ailment.
That point has
when
made.
People start to say that cannabis is not the cause of mental, which is true or which may not be true, listen very carefully. Our young ones there who know that when you smoke cannabis, you are able to do this. You become strong, you are able to act. Some sportsmen, some musicians that they are their mentors, they go try this thing. This is the beginning of the destruction of very potentials, including the highest of people to the lowest of persons. We need to be very careful as to what we churn out.
It's only that it's the same destruction of potential that a lot of people say may not be linked directly to marijuana.
I'm saying that if it is not directly to marijuana, whether marijuana contributes, even one person who commits suicide in Ghana is arrested. Things are not well for me. I have decided to take my life. Why am I supposed to be bothered? Who should bother me? Are you coming to give me my food and everything that I want to take my life and end up everything? We are concerned for each other. Are you getting that? Concern must be there, and we need to be very careful because some people wanted to use marijuana in in some drinks to treat asthma. And they ended up in the mental hospitals. You see, this is the argument. And there's a story of a young man, 19 years, who smoked marijuana for the first time, had a distortion in visual hallucination. He had visual hallucination. Saw the father is a chief, as a lion jumping on him. So he ran past the father, took his own gun, shot him dead before he realized that he's a father. How could it? It could happen to anybody. That gentleman could meet you, see you as a monster coming just because he has smoked marijuana and kill you just because we are not very careful about the message, the information we churn out there. We need to be very careful. That's what I'm saying.
Right.
We need to be very careful.
Okay.
And you know what? If we had the capacity to help people to stop only on marijuana and they will not graduate to other things, where they become social thieves that they didn't want to be. The journalist, the doctor, the lawyer who was practicing very well, turned a hard drug user and is arrested. The banker arrested for stealing money or shoplifting at Melcom.
As a result of use of some
As a result of drug use. The banker who holds 2 degrees had to jump over a counter and run to clinics for assistance because he was arrested shoplifting because he started with cannabis or alcohol. We need to be very... If it were going to be the last destination and then you don't have any mental complication and you were going to stay there, we wouldn't have... If it were going to be even only a personal problem, that your usage and the disease that you have will not affect other people, then we don't have a problem. If it was going to make you to stay there and it was not going to affect your sexual drives, and then you go arm rob people and sleep with their wives in their presence, and then that, as if that is not enough, you shoot them and go away. These are very serious things that need not to be... we need to stop the debate.
Right. So you're still watching News Desk on Joy News. You're speaking with Logosu Amegashi. He's the head of Addictive Diseases Unit of the Kolebu Teaching Hospital. We'll be wrapping up very soon, but I want to talk a bit about the other effects, the non-medical effects of some of these mind-altering drugs.
Now let's take alcohol. I have spoken all of them. I'm going to run all of them together. The issue of social responsibility, road traffic accidents, robberies, assaults, sexual perversions, prostitution, these attendant sexually transmitted diseases, and HIV/AIDS. A whole lot. They are there. In fact, those who are not even professionals could give you 1,001 of the complications because they have had people in their nuclear families and extended families who were doing things that they naturally wouldn't have done in the absence of the drugs.
I'm very curious to know how that would work, but we'll take a quick breather. When we come back, we'll continue with that conversation.